Wellness for Providence. I've worked in the cardiac pulmonary clinic for exercise, physiology, done a number of community health and wellness activities. So that's what we'll be talking about today as far as winter wellness goes. So with winter wellness, there's a number of topics we're going to bring up. So why exercise is important, especially in the wintertime. That's not to say that exercise is not important in summer or fall or the other seasons, but especially so in the winter. The difficulties of staying active in the winter, what we can do to stay active, and also there's some considerations to think about when exercising in the winter compared to other seasons that you don't really think about, that you should be thinking about just to stay safe. And so you can exercise for years on end. Of course, this will be mostly about physical activity. We'll be talking very little about diet and nutrition. Those kind of topics will be brought up in other presentations down the line. So yeah, we'll hop right into it. So why exercise in the winter is important? So obviously it looks like one is easier to exercise in and more fun to exercise in than the other. This is something that's been studied, of course. So in 2020, the National Recreation and Park Association pulled over 1,000 participants monthly for the year, and they found roughly 60% of all participants decreased the amount they exercise in the winter months compared to the others. So I would think that makes sense. If you think about your own life, I think about my life, and yes, there's a lot more issues that come up in the winter months that may hold me from exercising or limiting the amount of exercise because it's a limiting time of the year. There's very little we can do, but we'll be talking about what we can and cannot do. All right. So first off, why exercise is important. According to the AHA, winter has the highest rate of heart attacks than any other season. So this is something from the American Heart Association. There's a number of reasons for that. So we know that exercise in general provides many benefits, such as improved balance, muscle, bone growth, lower risk of type 2 diabetes, lower blood pressure, maintain weight. It's a stress reducer. But in the wintertime, you're going to see that there are cold-related effects on the body that may increase the risk or chance of a heart-related event. So something like that would be vasoconstriction. So when your blood vessels may constrict in the cold weather, a very extreme example of this is Raynaud's. If have you ever heard of that term? It's when your blood vessels in your extremities constrict so much that it really shuns blood flow away, and your limbs become really cold. So that's kind of an extreme example of that. But the deaths from coronary artery disease, coronary heart disease, were highest in the December and January months, and lowest in the summer and fall. So that's also from the AHA. Again, that's relating to increased blood pressure. So they find that, of course, poor exercise, poor diet, poor lifestyle is especially capitalized in the winter months. And so they see those increase in deaths and just poor heart-related events. Okay. So that's why we need to keep up our exercise. Like I said, the 60% drop in exercise routine, it's really important that we focus on the winter months. Exercise promotes bone growth. So we are most commonly deficient in vitamin D in the winter months. So we just aren't in the sun as often. The sun itself isn't giving off as much UV to give us the vitamin D that we need every day. So in the summer months, you need roughly 10 to 15 minutes of sun exposure to your limbs, so your feet, hands, and head. But in the wintertime, that could be as much as 2 hours that we need to get our daily allowance of vitamin D. So that's why we tend to, your doctors may recommend doing a vitamin D supplement. But that's the reason why we just are not getting enough of it. And vitamin D is really important. So it's the most common, again, vitamin D deficiency it helps with bone growth, immune support. Um, those two things in and of itself is very important. So exercise helps in both of those categories. So that's why I recommend exercise in the wintertime is it really helps offset the things that we don't get. So exercise really helps with immune support and bone growth. So what I mean by with bone growth is when you get older, you may start noticing that you're getting recommended recommendations from your healthcare team to do more strength related exercises. So strength training is great for bone health. It helps strengthen and promote the growth of your bones. So doing strength training on top of your aerobic activity is really important. Um, and then most commonly, exercise improves mental health. So you may not really notice it too much, but if you're doing those social interactions, the grouping with friends and family, those type of activities, they really help with your mental health. Holidays, for better or for worse, they can be really stressful or they can be lots of fun. Just to be with family, friends, parents, loved ones, grandchildren, um, really helps. That's tends to be their favorite time of the year for everyone. The holidays, increasing dopamine and endorphin response. This is how it's going to be helping that mental health area. So a stress reducer. You always hear when you're running the runner high or runner's high. Um, that is kind of a catchphrase, but it really is a real thing. And it doesn't need to be just when you're running. Any sort of exercise can elicit that effect. Really what's happening is you're exercising, creates a stress response in your body, and therefore your body then releases dopamine and endorphins, which are hormones and neurotransmitters, just to help regulate your mood. So doing exercise consistently and often can really help with your mood regulation. Okay. Let's see if anything else. Roadblocks to exercise you may experience. So, because I want you to think about some roadblocks to exercise that you experience in the wintertime. Um, if you could, if you can drop some in the chat, what are some roadblocks that you experience? I'll give a minute to think about that. Icy roads and sidewalks. Yes, definitely. Transportation issues. That's huge in the wintertime. Very difficult. Getting to work, that can be really stressful, just with those icy roads and sidewalks. Getting outside to walk and run. Um, yeah, especially if you have balance issues, for sure. Anything else? Okay. Lack of daylight. Yeah, not enough time to get out and be outside. Summer times you can get out in the morning and you can be out till 8 o'clock at night, and you have a lot of time to work with. Not like that in the winter, for sure. You get a couple hours at most. That's good. All right. So some of those I have listed as well. Um, some of these roadblocks we're talking about. So lack of motivation. Um, I think it can be an umbrella category for the icy roads and the lack of daylight. Um, there's a lot against you in winter and saying, it's cold outside, there's not much daylight. Oh man, transportation, I gotta get places. It's just you really have to have a lot more motivation to get out, get up and do something. Also, the fire in your house, nice and warm. You want to stay where it's warm. So I can get that. Definitely a huge roadblock. Stress. Stress can come from a number of things in the winter months. So winter holidays and work, and I kind of have that listed at the bottom. Those can be more stressful. Transportation stressful going to work. It's stressful shopping for the holidays. Um, a lot of things are brought up, so you just feel like you don't have enough time for it. The more stressed you are, the more time you tend to want to allot for yourself. So it could be, you just want to do more activities that are comfort for you. It's kind of like the whole comfort food thing. If you're stressed, you tend to want to eat more of a comfort food. Um, Same thing. You just want to do activities that are comfortable for you. All right. Access to facilities. Sometimes in the winter times, there's not as much to do outside, going to a nearby track or doing outdoor sports, hiking, not as often you can do in the wintertime, tennis, that sort of thing. So lack of facilities for sure. Injuries, health complications. So injuries and health complications, that's something that you want to be talking with your doctor about. If you do have anything that would be hindering for wintertime activity. So one example of this is COPD, asthma. Our pulmonary system tends to be compromised a lot more in the wintertime, just because it causes more inflammation. We're breathing in that cold air. But all these things that we're talking about, there are ways to work around them and with them. So, for example, the pulmonary issue I just brought up, so the cold breath, if you're wearing a mask, that might help reduce the cold component. So heats up the air that you breathe in. Also, breathing in through your nose will help warm that air before it gets to your lungs. Okay. And then lastly, the holidays that we just talked about. Thanksgiving, Christmas, those are the big ones that are coming around. Any holiday at all during the winter. It's just family gathering. It's really can be stressful, especially if you're shopping for gifts. The meals that come with it, the transportation, you're flying places, the road food. So, you're staying in a hotel or something and you eat out a lot more often. Even more so if you have, Uber Eats or something that you can just order in really quickly. So, pros and cons to that. So, what can we do to stay active? Um, so, I brought all these options here that are some great ways to stay active. Talk about a few of them. So, you have some of your traditional, conventional ideas. The gym, that's a very common one. By the gym, I mean that there are personal trainers that you can do. Um, they're like the YMCA. They have indoor pools. That is a fantastic way to get exercise. Exercises you a lot more than you think it does. And especially if you have injuries or health complications, it's very easy on the joints, the limbs, but it really works aerobic. It really helps with your body endurance. Dancing's great. We talked about the pool. I put on mini golf. There are a lot of mini golf places around Spokane that are indoors. I'm not sure how much activity that's going to give you as far as exercise goes, but you could play a mean round of mini golf. You could do like really quick rounds, or you kind of do a brisk walk in between each hole. So you can always play around, be innovative with your options. Stairs. Stairs you can do anywhere. Your work, your home. If you go to the mall or the store, take the stairs, not the elevator. That's a really easy way to get a little bit more exercise into your daily routine. Personal home exercise equipment, not everyone has it, but what is nice is that there are options for it. So a lot of gyms can rent out exercise equipment for you to use at your home rather than you having to have to go to the gym. And there are also some other options than just like your traditional exercise equipment. So there are a lot of things around the house that can act as your personal exercise equipment. So a jug of water is just under 10 pounds. So if you're a 1 gallon jug of water, that's about a 10-pound weight. So you can use that with certain exercises that you do. Canned goods is another option. Um, Again, you really just have to be innovative in the wintertime. The mall is fantastic, and especially the mall parking garage. If you're walking outside and you love walking, getting outside, the parking garage offers coverage. So you're not walking on ice. You're walking at an incline and decline, which is great for your muscle system, but it keeps you safe. You don't have a great scenic views for sure, but it's a great alternative to walking outside on the ice and snow. Um, so something to think about with that one. And then virtual exercise classes. That one's great. Some some gyms offer that. Even some of your kind of health districts will offer that as an option. So that's something to do as well. Um, yeah. Any questions about any of these that you've seen? Or actually, a better question would be, is there any activities on here that I've listed that you do that aren't listed here? Sorry, let you write some in the chat if there are any that you can think of that aren't listed. I don't know. Work desks, fantastic. Yep, those standing desks, those are great. Standing desks, treadmill desks, it's awesome. They definitely take a learning curve. Uh, takes a little bit, takes a little while to get used to it. If you have your standing desk, if you know the first couple of days, you're going to be kind of aching a little bit, but your body gets used to it pretty quickly. Yes, definitely. Typing walking skill. Yes. Any others that you can think of that aren't on here? If you do think of any, just throw them in the chat while we're going. All right, moving along. All right. So of all the things that we listed above, there's general exercise recommendations for doing those activities. So in general, regardless of the season, it's always recommended to get 150 minutes of moderate intensity aerobic activity per week. So um, uh, really good general rule, 5 days a week, doing 30 minutes a day. That's a pretty easy goal. Um, if you're someone who doesn't exercise at all and are trying to get into exercise routine, start small. Doing, 1 to 2 days first, then getting to more of the 3 day range, then getting into the 3 to 5 day range. Just kind of gradually increase it every week or 2 weeks. And what we mean by that moderate intensity is we give the talk test. So if it's moderate intensity, that means we can be speaking well, but we cannot sing during that exercise. It's tough to sing. 75 minutes of vigorous intensity, aerobic activity. That one's a little bit different with the talk test. It's really, you are struggling to get even a few words out when you're exercising at this intensity. So when it gets more vigorous, if you do have any health complications, I would say consult your doctor or healthcare team about it. It's more strenuous on the body. It provides some benefits for sure, but again, it's just a little tougher on the body. Some like HIIT workouts, those would be vigorous as well. So all things to think about when you're doing these activities on your intensity level. Depending on the intensity level, you do want to be allowing yourself some breaks. Not much so as the aerobic activity. You still want to be performing the activity for an extended amount of time before you take a break, just to get that aerobic benefit. And then strength training. We talked about this earlier with bone health, doing at least 2 days per week. So, you're doing your Let's say you're doing 5 days a week of aerobic activity. Mix in a day or two with those 5 days of doing some strength as well. Um, that'd be really beneficial. So strength training generally means, you're doing body weight exercises, resistance band work, some sort of weighted exercise to put strain on your muscles. Um, Aerobic activity is doing hiking, uh, walks, brisk walks, just to keep your heart rate elevated, and biking, those sort of activities. Um, with strength training, make sure you're not working the same muscle group consecutively. So if you're doing an upper body, you could do, shoulders and biceps one day, and then chest and back the other day. Those are both upper body, but different muscle groups. So you can do that. But you're not going to shouldn't be doing leg strength training one day, the next day do leg strength training again. Um, that's a good recipe for injury. Strength training and like aerobic activity, there are pros and cons. So you just want to be making sure that you're exercising in a safe way. 2 to 3 sets of 10 to 15 repetitions is a general good rule for doing strength training. What I mean by set is like a round. So if you're doing a round of an activity, say you're doing squats, you do 10 to 15 repetitions of a squat, and that's one round. And then you do 2 to 3 more of those rounds, giving a little bit of a break in between. So that's where you're no longer the aerobic aspect because you're getting those breaks. It's more that anaerobic aspect. Okay. Any questions about these recommendations for your activities that you do? Any idea how to engage dogs indoors? Um, Man, how to play with your dogs indoors. I got a puppy, so yeah, I've definitely had been thinking about ways to do that. Uh, Depends on where you're living. If you're in an apartment or a house, um, there's some there. I tend to do is because stairs works you, it also works your dogs. So throwing a ball up and down the stairs is a good idea if you have them. Um, Apart from that, yeah, there isn't a whole lot of ways to keep your dog active besides outdoor activities. Um, so it depends if you have a backyard. You could take your dog to, there are some indoor, I think there are some indoor like dog parks that you can take your dogs to. That might be a good idea. Yeah, I wish I could have a better answer to that question. Yoga mat to work during lunch and I stretch out. Wonderful. Yeah, we'll talk about flexibility here in a little bit. Stretching, flexibility, warm ups, cool downs, those are all definitely necessary. So that's great that you do that. Tough for sure, but I think it really makes the difference for the rest of your day. Exercise really gives you the energy. So you'll notice that once you get into an exercise routine, your energy levels start to go up. You notice that you can do more throughout the day, you can get more activities done. That's just that stress response that your body creates when it goes through exercise. It allots itself more time and more energy to complete tasks. So that's another great benefit of exercise. That's good. All right, moving on. So, special considerations and precautions. Um, we talked about activities. We talked about the recommendations for activities. So now, how to exercise safe in the winter. So first, regardless of if it's summertime or wintertime, we always need to stretch. Stretching is really important for muscle elasticity, injury prevention. Great. We always got to stretch and stay flexible. So if you're doing lower body one day, or you're going to go for a run or something, or run on the treadmill, make sure you stretch your lower body, of course. So you have muscles on the back of your leg, your hamstrings, stretch those. Stretching your quads, muscles on the top of your leg, your calves, your shins. You want to be stretching it all. Not too rigorously. So we say, if you're doing like a static stretch, static is when you're holding a position for a certain period of time. So say you're stretching your hamstrings, you're reaching for your toes. You're holding that stretch for 15 to 30 seconds, doing a few sets of those stretches. Okay. Also, flexibility, depending on the type of stretch that you do. So I just talked about static stretching. There's also dynamic stretching. So stretching that you do that requires movement. So if I'm holding a position on one leg, so you're doing like a groin stretch, so you're reaching to one side and then reaching back to the other side, going back and forth. That's kind of like a dynamic stretch. And that what that unintentionally does is elevate your heart rate, which is great. So we want to have, whenever we're exercising, we want to have a slow, gradual increase in our heart rate. And then when we reach peak heart rate, we want that heart rate to go gradually back down. So we have a warm up and cool down. That's what the purpose of those are. It allows our body to just kind of get ready for that stress response, which is really important for staying safe. Injury prevention. If you have joint issues, warm up and flexibility really helps with that. You may find that you may need a longer warm up the older you get. So that's why it allows those joints to kind of warm up. We have this fluid that develops around our joints, and the more longer that we do kind of a warm up, the more fluid helps lubricate those joints, allowing to have less pain during your workout. So same thing for cool down. If you are doing a tough workout or any sort of walking or kind of stressful activity, if you immediately stop, you may find that your heart rate and blood pressure drop pretty dramatically. So you may feel lightheaded, dizzy. So just make sure you kind of are coming down from that exercise slowly and safely. So say if I'm going to, I go for a run. You're run on the treadmill. So a good warm up is to do a walk on the treadmill. You can increase the incline a little bit, and then when you get to your main exercise, so running, and then once you're done running, you do a cool down. You bring it back down, the speed down to where you're just doing a brisk walk, and you're doing a walk for a little while. So you're not running and then just stop and go home. You got to kind of bring everything down a little bit. That's the safest way to do it. Hydration. You don't think about how much you need to be drinking water during the wintertime, but you do need to keep up with hydration. Summertime, it's easy because you're sweating all day if you're outside, and you're like, wow, I've sweat a lot. I need to go drink some water. Or you just have that that effect on your body. Your body tells you need to drink water. So you don't really get that in the wintertime. It's cold outside. The last thing you're thinking about is drinking cold water or any sort of fluid. So I guess hot cocoa is a caveat to that. But you still want to be maintaining hydration. So any exercise that you do, you're going to sweat. And most likely when you're going outside, you're wearing a lot of layers. And that's recommended for sure. So it's recommended to wear like a weatherproof jacket, then wear like a synthetic pullover, and then underneath that, wearing like a sweat wicking cottony material. That's kind of the best order for your clothing items. But when you got so many layers like that on and you start exercising, your hands and feet and your face might feel cold. So you don't feel like you're actually sweating, but you're on your core where all that clothing's at, your sweat response is pretty high. So you're perspiring a lot, more than you think. So maintaining that hydration really helps prevent any muscle cramps, any you pull a hamstring, something like that from happening. So just always maintain your hydration. It depends on what kind of body you have. If you're your weight on how much you should be hydrating. I think a general recommendation is 8 cups of water a day. Um, so sticking with that, making sure you're getting that water in. Snow shoveling. Man, this one is overlooked a lot. Snow shoveling is without a doubt a vigorous activity. So um, if you don't find yourself exercising a lot and then you go out to snow shovel, I've I don't know how many of you here have actually hurt yourself snow shoveling, but it happens often with people. So whenever you're doing an activity, especially if it's vigorous, you're doing a warm up and then the activity, you're stretching, and then cool down associated with it. Because it's also in the cold weather, it can definitely have an effect on your pulmonary system. So when we're doing vigorous activity outside in the cold, it's tough on your lungs. So making sure you're taking some time, taking some breaks. Um, you're taking, you say it takes 30 minutes to snow shovel your driveway. You take 5 to 10 minute breaks just to kind of help give your body a moment to rest throughout that activity. I saw that comment about the daylight. So that's another thing you have to kind of account for. We're doing outdoor activities. Summer times, it's recommended to, get out in the mornings and the evenings. That's kind of when it's the coolest. You obviously don't want to be exercising in 100-degree weather, nor would anyone want to do that. But in the winter times, it's the height of the day. So it's right in the middle. It's like the noon to 3 or noon to 4. That's when it's the warmest time of the day. So that's something to keep in mind. We talked about the clothing items to wear. Make sure you have your hands, feet, and head covered. That's where you're going to lose a lot of your warmth. Your core is obviously going to be the warmest. Um, and then if you do have any pre-existing health conditions, consult your doctor, healthcare team with how to go about exercising in the wintertime. See what they might recommend is like that's specific to your diagnosis. That would be the best call for that. Everyone's a little bit different and the precautions that they have to take. So just keeping an eye on that. Any questions about any of the considerations? Any thoughts that come up? Okay. All right. Some more precautions. Make sure that this is heart related, because it really, wintertime can put a strain on your cardiac system. If you do have any chest pain or discomfort, you're taking a seat, stopping immediately what you're doing, sit or lie down inside, please. Go to the ER if it doesn't go away in 2 to 4 minutes. Have someone there with you, or let someone know what's happening. It would be terrible for something to happen and no one know about it. So if you are starting to feel the anginal pain, a lot of different symptoms that come with it. Most prevalent is that kind of pain in the chest that goes down the left side of the body. Some people say it feels like an elephant's standing on their chest. Those kind of symptoms you definitely want to be wary for. Women, it's a little bit different. You tend to feel more nauseous. You tend to feel a little bit more in the stomach than men would feel. So just paying attention to some of those. If you do have some sort of severe nausea, shortness of breath, cold sweats, kind of irregular palpitations, if it kind of feels like your heart's beating out of your chest, again, sit or lie down. Call your doctor if it doesn't go away within 5 to 10 minutes. So closing. Well, all the options that I brought up, they're very irregular, I would say, compared to just, in the summertime, go to the gym, garden, do your yard work. That's a pretty good routine. But you kind of really have to be innovative and Make stuff up on the fly in the wintertime. Do what you can. It can be fun. Me personally, I don't like too much of a routine with my exercise. I like to keep things new and fresh. Trying different things. So you can definitely do that in the wintertime. All those indoor activities that were listed, um, those are all great options for getting people to go with you. Find a friend, find an exercise buddy. If it's your spouse or other family members or friends, get these like group activities going. It's a really great time to make an excuse to go out and do something and be with friends, um, go shopping, do all that mall activities. Um, yeah, those are give you an excuse to go do that stuff. Practice safe exercise methods. So again, staying safe with whatever exercise that you're doing. If something doesn't feel right, um, you know, you're not training for an Ironman uh, at this point in the wintertime. So you don't need to be pushing through anything. If you do have any pain or discomfort, just stop. Move on to a different maybe exercise or body group. Um, so just be safe. If you're starting new with exercise, start slow, start gradual, start small, and slowly build. Like any exercise routine, if it's with the holidays or you do want to be just kind of slow with what you're doing. One thing I did miss, I forgot to say, was with the holidays. Um, I talked about with poor diet and exercise. Um, Holidays, especially Thanksgiving, it's focused around food. I'm not saying don't eat your Thanksgiving meals. You can enjoy it, obviously. It'd be great to do it. But there's some little tips and tricks for it. So one, we obviously don't want to be saving up our meal tokens on the day. So you starve yourself until dinner time and then engorge on food. That is not the recommended a way to do it. Eat normal throughout the day. And then once it gets to dinner time, eat normal amount of the normal food portions that you would normally eat for a normal meal. Um, Another one that I've talked a lot about too in the past is leftovers. If you have any leftovers from holiday meals, give them to someone else. You can enjoy the food on that holiday, but it's the following days, if not week, of leftover food that you have. Um, you know, it's holiday food, should be enjoyed on holiday, but after that, throw it over to your other family members. I'm sure children or grandchildren would love it. So, last thing is anything is better than nothing. This is on the category of motivation. So, on days that you just feel like you cannot do anything, like I don't want to go out, I just exercised yesterday, I don't really care right now, I'm stressed, and I don't want to get up. Do something. Um, you could do some stairs in your house, do a couple rounds. 10 minutes is better than 0 minutes. 5 minutes is better than 0 minutes. So get up and do something. I find that when I dread going to work out, but as soon as I get there, I'm like, oh, okay, I'm here. I might as well do something. So it's kind of like that. You cannot put yourself in a position to where you're like, okay, I might as well. I'm already up doing something. So allow yourself that opportunity to get up and do something. Um, so yeah, those are the kind of the main big topics for winter wellness. Maintaining that exercise routine, always finding different ways to do something. And then so now, yeah, now we can open up for some questions about everything that we've talked about. If there's anything that's sticking out to you that you want to chat about.
I do have a couple messages that were sent to me in the chat and then a couple questions for you as well that I wanted to touch on.
Okay.
Someone had put in the chat that they were recently diagnosed with a cardiac related challenge and talking about needing to go to the doctor first. I think that's just another good reminder that you want to make sure we're doing it safely and that we're getting approval from your health team before we do any kind of activity. So I appreciated that comment. I also had someone recommending they bought traction cleats. Your thoughts, Kirk, about those so they can still brave the weather anyways and still be able to walk outside if you have any experience with those. That first.
Yeah, I've never myself used traction cleats before. It's a great idea. Yeah, if you're using it for, I mean, if you're using it for ice, I think no matter what, ice is kind of risky. But if you're using it for hiking, or just general walking outside in the snow, snow is better to walk in than ice. So just finding snowy areas, they provide actually surprisingly they provide more traction than just flat ice. So yeah, picking your areas smartly. But yeah, I think traction cleats would work.
Any tips or tricks for getting in some exercise when you aren't feeling well, physically or mentally? I know you talked about anything is better than nothing. Do you have any tips and tricks for how can we get that first motivation? How can we just get started?
Yeah, yeah, good question. So um, there are a number of things you could do. There's some I don't know, there's some apps that you can download that kind of have daily reminders to hey, get up, do something, or gives you little activities to do, and it might kind of get you started, and then you can go and do something from there. Um, Friends and family are great. Tell a friend or family member, hey, I've got to do something today. Get me up and do something, and they can provide some great motivation, kind of that external motivation for you. Having someone push you along is really great. Um, those are kind of the big ones I can think of.
That question in here. You talked about the layers of clothing when you're outside exercising. Can you repeat that one more time?
Yeah, yep. So I said wearing like a weatherproof jacket. It can be waterproof, water resistant, or like a windproof jacket, just to provide coverage from that external weather. And then you have like a synthetic pullover, something like a quarter zip. It's like a mesh fabric, kind of like what I'm wearing. I'm wearing like kind of a cotton mesh, kind of synthetic and cotton, something like that. And then underneath, wearing a full cotton clothing item, just to help with that sweat wicking. Kind of helps collect that sweat.
Those are all the questions that I'm seeing here in the chat. So I think we're good to go. Again, thank you for being here. It's such good advice and tips and tricks.
Yeah, I saw snowshoeing there as well. And is great exercise in the winter. Yeah, that's awesome. That you're doing that. Uh, you know, I would also count that as vigorous exercise. So stay safe when you're doing that. Um, it's much more intense as hiking. So staying safe, make sure you're getting that cool down and warm up with exercise with flexibility. Really important. But that's awesome that you're doing that.
Well, we will hang around for the next couple minutes if anyone else has any lingering questions. But otherwise, thank you all so much for being here and spending your lunch hour with us. I know it sounds like at least a couple of you were here on your lunch break. This is recorded, so we'll send out a copy of the recording when we're done here today in the next couple weeks or so. So if you have any questions, feel free to shoot us an email. We're always happy to answer any questions. Or again, if you have any lingering questions for Kirk, feel free to let us know. Otherwise, thank you all so much.
Thank you.